Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. I want to welcome everybody here to the Medical Collective. We're excited. This is our first episode. I have Dr. Dan, Dr. Atoosa, and Dr. Smith with me. I'm Dr. Keisha. I am your host. I am a board-certified pathologist as well as a personal trainer, and I can't wait for the episodes ahead. But today I'm going to introduce my guest, starting with Dr. Dan. How are you, Dr. Dan?
I'm spectacular. Thanks for having me. I'm a board-certified physician in pediatrics and emergency medicine, former Obama administration biodefense and public health appointee, and entrepreneur, biotech exec, and former military guy. So yeah, I'm here for all the fun and all the knowledge, and actually to learn something and to share and impart something to our audience. Thanks.
Great. I can't wait to hear what you have to say with me, Dr. Dan. Dr. Atoosa, how are you? Welcome. Please introduce yourself.
I'm doing very well. Thank you so much for having me as part of this awesome panel. I'm Dr. Atoosa Kourosh. I'm board certified in pediatrics, allergy and immunology, and public health. And I'm also a board certified patient health advocate. And I am an integrative and functional medicine holistic immunologist. And I practice in Texas currently, but I'm licensed in other states and do telemedicine to other states. And I'm chair of the integrative medicine committee for the American College of Allergy, Asthma, and Immunology. So I'm bringing the holistic and functional medicine perspective. It's wonderful to be with you.
It is. And Dr. Atoosa, please tell everybody what you do in your free time, because you're like me. You're multifaceted.
Yeah, I dance. I'm a yoga teacher, and I incorporate yoga therapy into my practice. Dr. Keisha and I have collaborated on mind, body, and health stuff before. I also am writing a cookbook of healthy desserts called Doctored Desserts, which means that I've doctored the recipes so they're healthy for you and they accommodate special diets like food allergies.
That's great, Dr. Atoosa. I can't wait. I've tried some of her desserts already, everybody, but you can look into her book. We'll share more in future episodes. Dr. Sharon Smith. Dr. Sharon, how are you? Please introduce yourself.
I am well. Thank you so much for having me. I am Dr. Sharon Smith. I am a board-certified obstetrician-gynecologist. I recently transitioned out of private practice, so I mainly practice obstetrics and gynecology as a locums doctor, and also growing an aesthetic practice. And I will soon to be board certified also in obesity medicine. So I'm really excited. Thank you for having me.
Well, we are excited to have you, Dr. Sharon, Dr. Dan, and Dr. Atoosa. We have several other co-hosts, but stay tuned for future episodes to see and meet them as well. You know, September, I feel like the summer was kind of a lull. I'm always into Health Awareness Month, but September has a lot going on, a lot. And I wanted to touch on a couple. We can't go through all of them, but it is Ovarian Cancer Awareness, it's Prostate Cancer Awareness, it's Blood Cancer Awareness, as well as Suicide Prevention Awareness Month. Don't forget Polycystic Ovarian Cancer Awareness, pain, AFib, which is Atrial Fibrillation Awareness Month, National Cholesterol Month, and even Childhood Obesity Awareness, Dr. Atoosa. So I wanted to touch on just ovarian and prostate right now, just briefly, because I think that it's important for our audience to know about it. So with Ovarian Cancer Awareness Month, Dr. Sharon, I'm sure you know, it's the fifth leading cause of cancer-related deaths in women in the United States, the fifth. Right now, it's about 19,000 women are expected or will be diagnosed with it, and 13,000 die from it. Now, as a pathologist, I diagnose these. There's different types. I would just put them into buckets, right? With the ovary, the outer surface has a certain type. Then there is the middle part or the stroma, and then there's the germ cell one. So it really depends the type on the age and really the prognosis, but we really want people to be aware that ovarian cancer, we have a friend, right, that has ovarian cancer, is sharing her journey, and it just really can affect us, and not until it hits home, I think. And so we really want to be this month, say, Ovarian Cancer Awareness. Let's read about it. Let's learn about it. And Dr. Sharon, I'd love to hear your thoughts. And Dr. Atoosa, I'm sure from the pediatric side, you have thoughts as well.
Yes. Yeah, ovarian cancer actually, it's typically diagnosed late unless it's truly an incidental finding. And part of the reason for that is just the way the ovaries sit in the pelvis and the abdominal cavity per se. So a lot of times it's typically a late diagnosis, but the way that we can actually help that is for your regular health screening. And I'm always an advocate for good lifestyle, healthy eating, a regular movement or exercise regimen, and those things will help decrease your risk of cancer overall. And if you have a symptom that just does not seem to be relieved, you go see a doctor. If you can't get a resolution from that doctor, find another doctor. Because that's the problem with ovarian cancer, is that's usually late diagnosis because the symptoms are usually non-specific a lot of times, and the symptoms usually present late.
That's good. And what about with bloating, Dr. Sharon? Do you hear that a lot with patients, that they're coming in with bloating or just upset stomach?
Yes. And I think bloating also and upset stomach needs to be investigated, because ovarian cancer diagnosis can be actually confused with colon cancer diagnosis. Some of the symptoms are very similar. So that in itself warrants, investigation, a workup. So definitely bloating that's not relieved by just even regular over-the-counter medicine or medicine prescribed by your physician needs further workup.
Okay, great. That's good to know. And I will say, from a testing perspective, you can get screened for breast cancer. You can get screened for prostate. You cannot get screened for ovarian cancer. There are blood tests, but there's no specific test that's going to say it's ovarian cancer at this time. Dr. Atoosa, what are your thoughts?
So I wanted to point out the interplay of microbiome changes to cancer risk. So this is something that is now coming to light, and it's true of colon cancer, ovarian cancer, and can play a role in several other cancers like breast cancer. So microbiome changes can happen when we're under stress, our circadian rhythms are disrupted, we take a lot of antibiotics because we have a lot of illnesses or things that come up, or that we eat a diet that alters the microbiome, like a highly processed diet. So not to victim blame, because I think that there's also ovarian cancer genes and also cancer genes in general. And the importance of early screening of oncogenes when you have a cancer history in the family is actually very important. But what you can do for prevention is basically work on your microbiome, and that's by putting into your diet healthy prebiotics, things that help the good bacteria of the gut grow and prevent overgrowth of bad bacteria. So, and also to prevent that sleep deprivation that we talked about, because sleep deprivation and sleep disruption can also change the microbiome for the worse towards the inflammatory and cancer-causing pathway. So these are the integrative medicine takes on cancer prevention, in addition to all the important prevention aspects that Dr. Sharon mentioned. But also, if there's cancer risk in the family, discussing it with your primary care doctor early on, because a lot of these cancer screening panels, genomic cancer screening panels, are now covered by insurance. And even if they are not, their out-of-pocket cost is under $300. So a lot of people who are at high risk could be checking their own oncogene or cancer gene risk by getting that screening early.
Dr. Atoosa, that was a great point. With the microbiome, what I'm thinking about is a lot of people think about bugs, germs. We've got COVID, we've got RSV, a lot going on, is that there's actually bugs or microbiome. There are things that live on our body, live within our skin microbiome, our gut microbiome, and they're actually keeping us healthy. They're necessary. So I would say it as there's the good players and the bad players. So when we deal with microbiome, we're dealing with the good bugs that live in our body that we need. And we can't disturb them. We got to treat them right.
Correct. So the microbiome is basically describing all the organisms that live on and in the human body that are not human cells. And people don't realize that we have a collection of important bacteria that help us with digestion and immunity and the balance of knowing how to tolerate food versus rejecting it, so it plays a role in allergy formation, and it plays a role in turning on the immune surveillance, which means like the white blood cells that seek out and kill early cancer cells. So the microbiome is a critical part of the human body, and our goal is not to be germ-free. Our goal is to have the right multitudes within us, the right bacteria balance that lives within us. And we know that things that disrupt that are processed food, antimicrobials like antibiotics, and not getting enough sleep and not having enough fiber in the diet. So these things can play a role in increasing your risk for cancer if you already have a genetic tendency towards cancer. And when I talked about oncogenes, those are the genes that tend to turn on when there's inflammation and lead to cancer. So if someone has an oncogene, they have an increased risk of that type of cancer. And through the genetic research that's happened over the past 20 years, we've identified literally hundreds of genes that can play a role in your cancer risk. And that's why it's important, if you know your family history, and you have colon cancer or breast cancer or ovarian cancer in your family or prostate cancer or even things like pancreatic cancer, you should get the genetic testing to see if you inherited those genes. Because if you did, then there's a stepped up screening or a more frequent and in-depth screening process. For instance, earlier screening for some of the things that wouldn't start being screened until your 50s. So I think these are important things to be aware of. And I think it is important to clarify what those things are, like the microbiome and cancer gene.
Good. I'm glad we're talking about that more too, especially with Cancer Awareness Months, and the increased risk of cancer in our youth that we're seeing. So thank you for that, Dr. Atoosa. Back to Dr. Dan. Before I do, I want to add a stat. Because with prostate cancer, we know that it's the second most common cause of cancer among men, and especially in African-American men. They're presenting earlier and more advanced stage of prostate cancer. So share us what we need to know.
I think it's important for men to go get checked, and it's just one of the things. And you can actually label it on the sex. It is males, and there's something about Black men, but men in general, we tend to avoid certain scenarios where it calls into question our health, and it's an avoidant type thing. I'm in control of my life. Maybe there's some machismo, and some is also just fear of finding out what's wrong. Will I find out something makes me inadequate? Those types of things. So those are challenges. And when it comes to prostate, definitely nobody wants the doctor with their gloves up there. And that's usually the way it's played out in the media, and they get concerned about it. And I understand it. I've gone through it myself. I remember actually posting a video about it, my visit to the doctor to go get checked for colon cancer, prostate. But same thing, they're on the same lines. The point is, it is invasive. We feel uncomfortable, and there is a risk, but I think we have to get over those things. And this is where the loved ones, family, relatives, and others come in handy to help usher them to the healthcare facility to get screened and have a dialogue with your doctor about it. I mean, even we have different initiatives that are actually initiating this out of the barbershop, out of the hair salon, out of places where people congregate, churches, mosques, and synagogues. And literally, they're having these conversations around health, meeting people where they are, so to speak, and having these important health dialogues. It is important, it's needed, and it does cause death. But those are the things that, because we're seeing it at an early age, we need to be screened early.
Right. Thank you. Also, I think that when we're at the barbershop, we're at the beauty salon, and we're gossiping, let's push forward this conversation, as Dr. Dan said, about our health as well. Hey, did you know also, did you go get your screening done? Have you been to the doctor? Have you talked to Dr. Sharon? Have you talked to Dr. Atoosa? So be encouraged, but also while you are in these social situations, make it an imperative to talk about health, especially with the upcoming election, which is important, that we know that we need to know the facts about our health to make that decision that's right for us and our family. So thank you for that, Dr. Dan. Okay, lastly, and I want to thank you all for listening into this amazing podcast, is things in the news, right? It's back to school. It's September. People are going back inside. I'm still in the South, so it's warm here. But we need to be aware that RSV is rising and has been. Flu hasn't gone anywhere. COVID-19, though it's changing, has not gone anywhere. And we need to be aware of our risks when we're traveling. The ER visits, is it crowded at the ER? Can I go in? What should I do? When do I go to the ER? So, what should we be looking for? We'll start with Dr. Atoosa, because as a pediatrician and allergist, you're dealing with, my daughter has asthma. So I really get scared when she starts back to school and thinking, oh no, she's going to have an asthma exacerbation because of all this. So.
Yeah, I think that's a really important point, especially since now there's RSV vaccination available for adults, older adults over the age of 50, but it's not really available unless you have a condition that qualifies you. So I think that it's important for asthmatics and people with lung conditions to get all the vaccines that they possibly can. For instance, there's a vaccine for pneumococcal infection, a pneumonia prevention vaccine, and that's given to babies under the age of 2, and then not given again until the 50s or 60s, unless someone has a respiratory condition. So knowing that you have a condition that qualifies you to get extra vaccination might be one way of preventing these infections that happen in the fall and winter months. So making sure you're boosted up from a COVID perspective, flu, RSV, and pneumonia vaccine. So these are the one of the most important things when people talk about immune boosters and taking a supplement as an immune booster. We know as immunologists, nothing really boosts your immune system except vaccination. That's what boosts your immune system. So not that I'm against taking those supplements, because vitamin D, zinc, vitamin C.
Emergency doesn't work, Dr. Atoosa?
Yeah, that is, not emergency, but like other kinds of vitamin C. I don't endorse a particular brand, but I do take supplements, when I'm exposed, and I'm exposed because I'm a pediatrician and I'm seeing people with infections. So I'm as exposed as a school teacher, who gets a lot of exposure, right? So, but I think that, people also, saw that during the pandemic, especially with wearing masks, that there were fewer contaminations or fewer cross infections of certain respiratory diseases. So if someone is sick, you can help by masking if they're going to go to school as they're recovering from an illness. Hand washing is very important, and people forget that, now that we're out of the main, early stages of the pandemic, that hand washing and mask wearing can still make an impact on disease transmission. I know that the all-time low flu infection year of the past 100 years was winter 2020. Yeah, winter 2020. We had the lowest flu transmission of any year ever since flu was started to be tracked. Flu started to be tracked 100 years before. So that's important. So I think thinking about those kind of things is important. And then also thinking about what to do with respect to protection against other respiratory infections during the winter. So one of the things I always keep around is saline rinsing. So I'm not going to show the brand name because, again, I don't endorse brand names, but allergists will do this all the time. They'll rinse their nose in front of you. So I'm spray saline into my nose. This helps with if you're ragweed pollen allergic, because ragweed is in the air in the fall and there's fall molds that people are allergic to. It helps rinse out allergens out of your nose, but also helps to rinse out viruses. And the salty environment prevents the growth of bacteria and viruses. So that's one of the ways, because we know that as weather temperatures drop and it gets colder, certain viruses thrive in the colder air environment at the tip of the nose. And one of them is influenza. Influenza likes that 93 degrees Fahrenheit, 5 or 6 degrees below human body temperature. So when our nose gets cold, we can actually incubate some flu virus. So that's one of the things that you can do is rinse out viruses. And especially if you're exposed in an environment like school, when you're inhaling a lot of pathogens, if your daughter rinses as soon as she gets home, she might remove something that might otherwise infect her nose and therefore her lungs eventually.
Well, let me tell you one thing about my daughter. She's a teenager. She is rinsing morning, noon, and night. So I don't have to worry about that with her, but it's good to remind everybody. Thank you, Dr. Atoosa. So let's go from babies to women. Dr. Sharon, those women that are expecting or not even expecting, maybe even dealing with cancer, what do you say for this season about infections? Because I know during COVID, it was scary, right? Because you're dealing with an individual carrying a life, and the possibilities with infection can go over to the fetus, right? Wonder if the fetus is going to survive, and, trying to protect both of them at the same time can be difficult. So what thoughts do you have for your patients?
So I recommend universal precautions, hand washing. When I'm around patients, I still mask up, especially now COVID is rising. It's still out there. It hasn't gone away at all. And I do recommend a full, complete series of a COVID vaccine if they have not been vaccinated, and the boosters. And there's a new booster out now currently also. We do recommend flu vaccine in pregnancy for it protects mom, protects baby. And we also recommend Tdap vaccine in pregnancy. Generally, most people have the majority of the vaccines before, but sometimes these ones are maybe lapse, just like the Tdap, because it's every 10 years. Flu is yearly. COVID is now probably going to be yearly, or additionally, whenever we get a new booster. So I do recommend those, and I recommend universal precautions, hand washing, and especially if there's someone sick in the house, you want to try to, keep the pregnant person or even a newborn away from that, and that will help decrease transmission. Because we know that pregnant persons who are sick with COVID or flu can become critical. They'll be in the ER, and Dr. Dan would have to start taking care of them before I get there. So we want to exercise every precaution that we can to help protect, pregnant persons and their unborn.
So important, Dr. Sharon. And the one person that we don't want to see, just like you don't want to see me, is the ER doctor. So our case is already rising in the ER, Dr. Dan. What do we need to be looking out for?
Our cases are definitely rising, and by the way, I prescribe pepper soup for everybody.
So my husband says that. He's like, "Oh, I'm sick. I need pepper soup."
That's right. Yeah, I just got over COVID about 2 weeks ago, and I literally had that, and I felt better. But natural remedies are important. To Dr. Atoosa's point, they support the immune system and let them boost your immune system, to her point. But yeah, those are the things we do, natural remedies. But with regards to cases in the ER, yes, I'm overwhelmed. As you see, I'm in scrubs, getting ready for my shift. Yeah, we've been seeing a lot of volumes, parvovirus, metapneumovirus, RSV, not as much yet, but we're seeing bronchiolitis caused by other viruses, parvovirus, parainfluenza virus, and then, of course, we have COVID. Haven't been seeing a lot of flu at this time yet, but it's coming. But the COVID volumes definitely have spiked. I mean, they're seeing it in water and sewerage and all the other things, but the volume in the emergency department definitely is on. So the things I recommend, the strict hand washing, things everybody's practiced. We know this like the back of our hands now. Everybody in the public should know this by now. We had lockdowns that we didn't like, so we learned the rules. Wear your mask, wash your hands, protect yourself, protect your family, and those types of things, in addition to vaccination, especially if you're in that high-risk category, without forcing anything down anybody's throat. But I think people need to protect themselves, and thank God I got through that process. But, there still are long-term risks, so we're not always out the woods, and we're learning more and more things about COVID, so please be careful and be safe out there.
That's good. And what we learned from the last couple of years is you can have more than one thing, and sometimes they can present the same. So there are tests that cover RSV, flu, and COVID. And there's not updated, but there are actually over-the-counter tests that are now available. And by mail, the government is now doing another round this September of free COVID tests. So go to covidtest.gov and you can get your free COVID test. Even though it's changing, the test targets something different than where the spike protein is, where all the mutations are happening or the changes that we're seeing. So the home tests still work. There's 2 in a box for a reason. If the first one's negative, wait 48 hours to 72 and retest. If you're having symptoms. If you're not, you may not get a positive test because you may not have a higher viral load. So PCR is the special thing when you're in the hospital or you're at the urgent care because it's able to amplify the small amount you have and detect it. Home testing cannot do that. But there are tests over counter that are a little bit more that are molecular tests. So look into those as well if you want to. They're a little bit more pricey. So I recommend home testing for free or just protecting yourself and doing the precautions you need. All right. Well, this was great, everybody. I'm looking forward to the next ones. I would just say if you have questions or you're like, hey, Dr. Dan, Dr. Atoosa, Dr. Smith, or me, I want to hear this. Follow us on Instagram at The Medical Collective, the Facebook. You can also follow Dr. Dan, Dr. Atoosa, and Dr. Smith on their respective social media accounts. You'll be seeing us and pictures of us. We'll be doing lives. We have so much more to talk about, from what's going on with Doctors Without Borders, what's going on and we need to know about the election, and what frontliners are doing. So stay tuned. Any final thoughts from my colleagues?
I would just say stay tuned. We have a lot coming.
We have a lot coming. We might even do like some fitness routines, some yoga. We have a lot of special talents. I'm waiting to see Dr. Dan's special talents as well. Maybe he sings. I don't know. Dr. Smith may play the piano for you.
Only drums.
Oh, the drums. That's it. We're going to have
Drumsticks,
drums.
soccer. I mean, there are many things. However, I think we'll keep them informed. And also on policy-related issues, we'll just talk about COVID vaccines. And now that they're really pricier, and certain assurances aren't covered, and we got a lot to talk about to keep people informed and how we bypass that, taking care of their children and have cold winter injuries. I mean, there's so many topics we're going to need to talk about. But yeah, like Dr. Keisha said, I think putting something in the comments for us with regards to the topic you want to talk about is important, and we're human. So we are just like you. They're not like us. So we're just talk about a lot of things. Thank you for having me.
Thank you, Dr. Dan. Dr. Atoosa?
Yeah, like Dr. Dan, I'm really looking forward to the conversation. People don't realize that we've been working community-facing and informing the public together as a team for a couple of years since the beginning of the early days of the pandemic, more than 3 years ago. So I think we have a lot of information to share with you, and we are adaptable to what you want to learn. So like Dr. Dan said, but I think it's an exciting time, and I want to reiterate that it's not just a scary time. It's also an exciting time in the world with a lot of possibilities. So, and a lot of opportunity to take control of our own health. So I want to empower our audience to come to the Medical Collective for information that you can use to change your life for the better and to protect you and your family as the world changes, as the environment changes. And we can talk about impacts of environmental health on things like allergies, the human microbiome that we mentioned, the emergence of infectious disease. We've talked about this a lot over the past few years amongst ourselves and in other community-facing panels. And I just really look forward to the conversation with these brilliant doctors on the team here. Thank you so much for having me.
Oh, you are so welcome, Dr. Atoosa. And I'm looking forward to the future. And you know I love AI, so there's going to be AI in medical talk as well. And just a fun fact before we leave, we met on a social audio app, literally, from different places, some of us in the same place. And we met on an app 4 years ago, and we're still keeping the conversation going. So thank you all for being here, and have a great night. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life.